Welcome to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes. Welcome, and thank you so much for joining us on Beyond the Article, Health and Communication Distilled. My name is Deanna Amarosa, and I'm the current Communication, Technology, and Social Media intern at the Journal of Communication in Healthcare. I'm here with our author, Prince Adu Gyamfi, and he is from Brian Lamb School of Communication at Purdue University. Today, we'll be discussing his research, Managing Anxiety and Uncertainty, applying anxiety/uncertainty management theory to university health professionals and students' communication. So Prince, can you please start and provide us with a brief 1-minute summary of your research?
All right, thank you, Deanna. So previous research shows that health centers on college and university campuses provide quality primary healthcare services to students. However, students are underutilizing these campus health facilities due partly to their uncertainty about health services provided at these centers. The study found that students reported using trust, relaxation, and information seeking and giving as strategies to manage their anxiety and uncertainty. So this is a brief summary of my research.
And just to follow up, based on your research, what are some recommendations for college students to help manage their anxiety and uncertainty when utilizing these campus health facilities?
My first recommendations relate to the relaxation techniques. College students can employ some basic systematic desensitization techniques, such as taking a deep breath, listening to music, and working out more before the appointment to deal with their physical symptoms of anxiety about the anticipated communication. These techniques will help them to stay calm. Second, college students can use some basic cognitive restructuring techniques, such as staying positive, focusing their minds on things one enjoys, and avoiding negative thoughts. And then my second and last recommendations relate to the information seeking and giving strategy. College students can gather information about their health problems and symptoms through Google search to learn more about their health symptoms. They can also gather more information about the health center through their website to learn more about their services and the health professionals working in health facilities. Then lastly, college students should feel free to ask a lot of questions during their interactions with the university health professionals. Also, they should clearly explain their health problems to the health professionals to avoid misunderstanding, which often leads to uncertainty and anxiety. So these are some of the recommendations I have for college students.
Just to flip it onto the other side, do you have any recommendations or actions for the university health professionals when they are communicating with students?
So my first recommendation is that university health professionals should provide a friendly environment that will encourage students to feel free to ask a lot of questions if they don't understand anything. More specifically, they should intentionally solicit questions from students during their interactions. This will help to address student concerns, making them feel less uncertain and anxious. Second, university health professionals should allow students more time and opportunity to express themselves freely and confidently. And lastly, or additionally, university health professionals should find more friendly and assuring ways to explicitly assure students that their health information remain confidential. This will help students feel less anxious and more willing to self-disclose more information. This will also encourage students to trust the health professionals with their health information.
Great. And is there any more information about what support systems there are to implement these recommendations which you just mentioned from the article?
I would say that I would also tie it with policy level, whereby they would have some kind of a messaging at here at Purdue. They do it frequently where even if you are going to the bathroom, there is that kind of like a message system where it displays whatever you have to do. Maybe have some messages that will be posted on the washrooms so that even in their dining hall, so that when you go, you can also see them and then, for example, read them, and that would also help them. And in addition to that, I would also say that, for example, if you are going to the health facility, they should provide some kind of like training for the health providers there so that at least they can refresh themselves with some of these skills or maybe these findings that, hey, if you go there, if somebody comes as a student, can you assure them that, yes, the information that you're providing for me would be, I will keep it confidential. And that would also encourage them to self-disclose more information. So this would also tie to maybe policy at the policy level and then at the health center level.
Yeah, great point. And it kind of relates to our next question. What are some of the potential implications and impacts of your research on university policies, which you mentioned? And also, could you talk a little bit more about those implications on health communication practice as well?
Here, I know that universities and here too at Purdue, they have like what we call the Wellness and Health Promotion and Wellness Department of Higher Education, where they sometimes weekly disseminate information. They should also include messages of this kind. So if they include like, these are some of the messages, basic messages, like when you are going to appointment, feel free to ask them questions. And some of the messages should also encourage like students to use some kind of like basic systematic desensitization techniques, like taking a deep breath, or maybe I'm listening to music. And also one thing that I also want to add to is that at every institution, they take this public speaking class. And there's also a portion about maybe communication apprehension. Maybe perhaps they can link up with the instructors or maybe the supervisors for them to also get into maybe treating that topic. They should also encourage that, oh, this technique that you are reading for public speaking, you can also be used it for when you are going for appointment, because it's anxiety and it's about communication, regardless whether it is a public speaking. If you're having an interaction with the health professionals, you can also use taking a deep breath so that it brings to their mind that, oh, these can also be linked to that one. And particularly, I would also say that in terms of like health communication, I would say that this study did not test the strategy that the study found, like the relaxation techniques. The other techniques would also be information given and information seeking technique. They didn't test it. So I cannot say that this is effective. So to expand or maybe extend this kind of study, conduct study, probably experimental study, or maybe correlational study to see whether these messages that are being recommended here are very effective so that it can help, it can become part of a university policy, because we are suggesting that it should be part of a policy. But if it should be part of the policy, are they going to be effective?
Great. Thank you so much. I was just thinking, there's so many different reasons for a student to have a healthcare visit. They might be going for physical reasons or maybe a mental health concern. Is there a way that a healthcare provider could change their behavior in order to better manage a student's anxiety based on the reason for their visit?
Great question, because I have done quite of studies regarding this topic. What I would say maybe is that at the comprehensive, like broadly speaking, you can, for example, anybody who comes there, you can assure them that, oh, whatever information regarding whether it is relating to your mental health, relating to maybe your health reproductive issue or sexual issues or whatever issues that you bring, everything will be kept confidential. And I think that even if you go to mental health, the counseling, they would also have that on board. Probably future research could come in and be more specific and take maybe more specific health problems. That would also help to have more specific antidote or maybe technique to help students specifically. So for now, that would be my take on that.
We were also wondering about the healthcare provider behavior, perhaps in terms of cultural humility to attend to the needs of different groups.
For that one, I remember I was looking at international students because of their cultural differences. So it was talking about more of an adaptability. And sometimes it tells the health professionals to be more like patient and more ready to listen, and then make sure that you are at least listening to them, and you're also adapting based on the conversation. They try to adapt to whoever they are speaking, regardless of maybe their background, whether they are Americans, whether they are international students, and even their religious and language differences. They should also learn to also adapt.
Just wanted to ask if you have any closing thoughts or messages you want to leave our listeners with from your research.
One thing that I would say is that, yes, it's normal to be uncertain, and it's also normal to feel anxious. It's about having a partnership. So see the health professionals there as a partner in whatever decision that you are making, and that would also help you to feel less anxious.
Thank you so much, Prince. Thank you for joining us today and sharing your insights on this important research. Thanks for listening to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.